Welcome to Indications. My name is Nick Strasser. If we haven't had a chance to meet, I help put together this YouTube channel with the focus on learning orthopedics from a medical sales perspective. In this video, I'm going to break down what you need to know about gait mechanics if you're a medical sales rep. Now, you're probably saying to yourself, do I really need to know anything about gait mechanics? And you probably don't need to know it from a clinical evaluation perspective, but there's a couple things that I think are important to understand the background of so that you can understand what it is that we're looking for in the operating room. When it gets into gait mechanics, there's two main parts to gait. There is two phases. There's one in which we call the stance phase, where the foot's planted on the ground, and there's one in which we call the swing phase, where the foot is swung through the ground or swung through the air to lift and to as you propel yourself forward. The swing phase relies on the tendons and motor function on the front part of the foot to help dorsiflex the foot up and down. So like anterior tibial tendon, extensor hallucis longus, the lesser digit EDL tendon help lift that foot up in the air to help propel you forward. That becomes important because if you're talking with surgeons about tendon transfers, you'll sometimes see us do either an anterior tibial tendon repair because that helps with swing, or a tendon transfer if they've lost function through a nerve injury, whether it's trauma or a laceration, that can create a foot drop. So we'll sometimes do tendon transfers to help restore that swing phase. But I'm going to talk a little bit more about the stance phase, and I'm going to talk about it from a perspective of ankle-foot reconstruction. When the foot goes into stance phase, that's the part of the gait in which your heel will land on the ground, and it'll kind of land on the outside part, the lateral part of that heel as it lands on the ground. And the foot is a little bit inverted. We've talked about that before, or in a little bit of varus, where the heel comes a little bit medial relative to the rest of the ankle. And as that foot lands, the heel now tilts laterally or tilts to the outside part of the foot, so it goes into what we call valgus. Now, this is the really cool part of this, is that the subtalar joint, the talonavicular joint, and the calcaneocuboid joint will line up, their axis of motion will line up when the heel goes into valgus. And what that does is it puts them all on one singular plane so that they all unlock, that they move back and forth much more freely. It makes the foot much more flexible. And as you can imagine, when the foot's landing, that allows that foot to absorb shock. Now, as the gait goes forward, as it goes into beginning to do what we would call push off, the heel will get pulled in, and the posterior tibial tendon actually pulls that heel back medial or into varus, and then that will lock the Chopard's joints, or the talonavicular and calcaneocuboid joint, to make the foot a little bit more stiff and propel you forward, almost like a spring effect. Now, there's some other things that are happening too. There's dorsiflexion of the metatarsal phalangeal joint, and that tensions the plantar fascia and creates what we call the windlass mechanism to help create a spring effect. But why am I talking about this, and what does it have to do with being in the OR? Well, when you get into the operating room, you'll sometimes hear surgeons talk about getting the heel in the right position if you're doing an ankle fusion or if you're doing a TTC fusion. And the reason it's important is because we want that calcaneus to be into a little bit of valgus, in the hindfoot in a little bit of valgus, about 10 to maybe 15 degrees. And what that does, as we already talked about, that lines up the axis of the talonavicular joint and the calcaneocuboid joint, and that unlocks those joints. So now you have a little bit more motion through the middle part of the foot, and that gives you a little bit more flexibility of the foot, so that if you have somebody with a fused ankle, they have a little bit more motion in the midfoot. So it allows them to have a little bit more flexibility, ability to absorb shock, and it gives them a less of a stiff feeling. There's a couple other things we look at, things like getting the ankle at a right angle, so 0 degrees of dorsiflexion. And we want to make sure that the talus is centered directly underneath the tibial axis. And all of that helps with having just a more normal feeling when you talk about an ankle fusion. So that's where gait mechanics plays a role when it comes to the operating room. There's obviously multiple other ways in which it can play a role, but I think it kind of helps you understand what we're looking at. We're looking at that calcaneal axial alignment view, the Harris view, or sometimes we refer to it as a Saltzman view, to see where the heel sits in space relative to the axis of the tibia. We want to see about 10 to 15 degrees of valgus to unlock talonavicular and the calcaneocuboid joint, give you more motion through the midfoot, and allow you to have a more flexible appearing foot. If this video is helpful, make sure you push the subscribe button below. We'd love to connect and have you join us for more videos. Take care.